So to carry on where we left off, let's talk about some of the dynamics of your spine and how your spine works, okay? Back pain. You have to stop in the middle.
It was back to the thing.
Is it right to the left? Okay. Go to the far corner, you know, the pocket right there.
Okay.
So back pain, common and costly. Would you guys agree? How many people here have back pain? Put up your hand. All right. How many people here have taken drugs to get rid of the pain? Put up your hand. Right. Right. The drugs help for a little while, but my question to you: has it resolved the problem, or does it always come back? I find as a doctor for 30 years, people have a common problem, is that the problems continue to come back. So you have to keep going back to see the doctor. It becomes this vicious circle, right guys? I'm going to show you guys how to break this circle and to have your own life back. Because let's face it, with back pain, you're put in a box. You can't go and do things that you want to do. Would you guys agree? You can't play the sports you used to love to play. You can't go for walks. You can't do exercises. Some of you might have grandchildren. You can't play with your little grandchildren or pick up your grandkids. And it becomes literally debilitating, you guys. I've got some really awesome information to share with you guys tonight. You guys are going to really enjoy what you have to present, okay? Okay. It's pulling some stuff up there the side. Don't watch the same thing. Get rid of that thing. Just get rid of that thing. Just tap the side of the screen, it'll go away. Go to the side of the page. Okay, stop there. 70–85% of people will suffer from low back pain at some point in their life. Those are pretty high odds, aren't they? Over time, in fact, I think the stats are even higher. Probably over 90% of people have back pain. All right? The question is, how do you resolve it, right? You want to get out of your pain and you want to have your life back. Because I'll tell you, you become a prisoner within your own body. That's what happens. Back pain is the second most common symptom to which people visit a medical doctor. You know what number one is? Hurt. Hurt, yeah. Okay. It's no wonder back pain patients resort to drugs and surgery, okay? Surgery, okay, is it good? Does it work? How many people here have had surgery before? Okay. Have you had surgery? For surgery and back pain, it's successful in only 30% of the cases. 70% complication rate, you guys. What's the complication rate? It can be anything from paralysis to chronic pain to being in your wheelchair the rest of your life. The consequences are horrible from surgery. I'm not knocking surgery, don't get me wrong. I respect medical doctors, I value them. Some of my best friends are medical doctors. Some of them are my patients who I've helped get rid of their back pain. It's no wonder back pain patients resort to drugs and surgery, right? Because you want to get rid of our pain, and we'll resort to almost anything to get rid of it, won't we? And we trust our doctors, and drugs are important, but there's other ways to get rid of it, and I'm going to show you how that's done. So before you consider these options, shouldn't you try maybe a highly effective and non-invasive procedure? Would you guys agree? Totally, right? The more invasive we get, the more complications there are, okay? Spinal decompression may be the answer. We have a handout here. We're going to give you guys some handouts, but I'm going to give them to you at the end, okay? Otherwise you'll be reading that and I'm listening to me. Okay. So what is decompression? Spinal decompression is a type of mechanical traction, okay? And it's not just traction, right? Some people say when you pull things apart, it feels good, but it's oscillating mechanical traction. I'll explain that. What is decompression? It is commonly used to treat back or neck pain due to, anybody guessing? Compression? Gravity. Sciatica, okay? Who's heard of sciatica? We all have, right? Herniated disc, degenerative disc, or disc disease, and spinal stenosis, and more. Stop there for a second, Sandy. You guys know what spinal canal stenosis is? Okay, you know what it is?
Choking of the spine.
Your spine's getting choked, right? When it gets choked, guess what happens? You can't walk very far. Your nerves going down your legs are getting choked. It's like trying to water your garden when the car's parked on the garden hose, right? You go, how many people have gone on vacation, turned on the hose, and you came back a week later and your grass was yellow? But you didn't realize somebody parked the car in the garden hose a little bit, and maybe around the sprinkler, 3 feet around the sprinkler, it's nice and green. But anything beyond that was yellow? What happened? It didn't get water. Same thing with spinal canal stenosis. Your spinal cord gets choked, the nerve energy is not getting down your legs. So let's say, as we get older, you want to go for walks, you want to do some exercise, right? I'm going for a walk today. You can't walk very far with spinal canal stenosis, you have to keep stopping. You got to rest until the pain goes away. Then you can walk a little bit further, you have to stop and rest until the pain goes away, until the nerve energy gets down into your legs. It's also what spinal canal stenosis is, and it inhibits your body's ability to walk distance. Very frustrating. And patients come to see me and say, "Doctor, I can't walk anymore. I want my life back." We've got a whole protocol for spinal canal stenosis as well, but we're going to be talking about decompression first, okay guys? So decompression is a specialized table and computer control unit which applies a precise distraction, tension, or pull along the axis of the spine. So literally, it pulls your spine apart. Okay? It pulls and relaxes, it oscillates. That oscillation creates a negative pressure within your spine which begins to retract the bulging disc. Make sense? I know you guys can't hear this, but I mean, we used to play a game when we were kids. We put water in our hands like this and we'd squirt it out. You guys ever do that? You put your hands in the tub, you squirt it out. Can you hear my hands go squirt? Right? Hear that? And then when I pull my hands apart, it goes contract and you hear my hands, when I retract, it squeezes out, and then when I pull them back, you hear a sucking sound? Okay, I don't know if you can hear it back there. Every time I contract my hands, and then contracting, it sucks back in. That's what spinal decompression is. We pull the spine, and then we relax it. It creates a negative pressure within your spine by 128 micromercurial grams of pressure. We have some statistics up here, you can read those later. But that's what retracts the bulging herniated disc. Okay? Because when the disc is bulging, what's the pinching one?
Nerves.
Your nerves. And it hurts, doesn't it? It's excruciating pain. Next slide. This distractive tension with special positioning of the body gently unloads and separates the targeted bones of the back. So it pulls them apart, okay? And then when it relaxes, it removes that compressive force on the disc, and then it targets a specific area of your spine. Now you might have people you have to find out what disc level is bulging in the neck or the low back to treat, right? Most people's commonly your L5-S1 disc, okay, which was the very bottom one. You have 5 lumbar vertebrae, which is your low back, okay? You have 5 of them. It's usually the bottom disc, the L5 and the sacrum, where it attaches there. It's that neuron that gets the most compressive force to it, which is usually the common disc that's bulging or herniated. Some of you may have seen some x-rays or MRIs from your doctor. It's usually your L4, or L5, or S1 disc. Okay? Is that ringing some memories in here? Okay. Although most commonly used for the low back, it can also be used for other areas to treat. We also do the neck as well. And wrists. You can use distraction for the wrist, but we don't do that for wrists. We primarily focus on neck and low back. So the equipment, what kind of equipment do we use? I'll talk to you about the different types of spinal decompression protocols there are. There's a wide variety of spinal decompression equipment that exists on the market today. And all spinal decompression tables perform the same task and consist of 3 basic components. The tables differ in extra options that are available. Okay, if you stop it here, the one we have here on the left right here, it's called the DRX 9000. That's the unit that we have. Okay. It also we have a cervical spine unit, which is not shown here. You have a VAX D, which is down here. All right. You have a Chattanooga, and this one is the ABS Ultra. This one's not even in production anymore. But of all the ones I looked at purchasing, this one had the highest success rate right here. It's very effective. We put literally hundreds of people through the protocol. Interesting story. 2 medical doctors came to see me. they had back problems, and they had, one fellow was a surgeon, I can't tell you their names, I can't expose that, but he said, I'm a surgeon, but every time I've been over to do patients, my back kills me, I can't do surgery anymore, doctor, what do you recommend? I said, why don't you consider surgery? He says, absolutely not, I would not, I don't want that risk. This is a surgeon talking to me. We put the gentleman on the table. It took 8 weeks to put him back together. He's 100%. This was 3 years ago, and I just talked to him about a week ago. I said, how are you doing? And he said, you know, doc, I'm doing great. I said, that's fantastic. Imagine that. Chiropractor helping a medical doctor. Actually, I've got quite a few successful professions, medical professionals who are my patients. Why? Because what we do works, you guys. There's 2 other tables that are listed in here. They'll come on the next slide. I'll show you. These 2 as well. The Saunders, okay, and the other one, but you don't have these ones are the cheaper versions. They don't work that well. Spinal decompression consists of 3 main components: a decompression table, as you are aware, a computerized traction control unit, which tells how much force we're going to put, and patient harnesses. You're hooked into the machine. It has to pull in 2 different directions to decompress the disc. First, your doctor will perform a physical exam and evaluate to ensure decompression therapy is safe and suitable for your condition. Not everybody qualifies for it, you guys. We do a complete orthopedic, physical, and neurological exam, and of course we take a history. So we want to find out where you guys are coming from and what damage you've had over the years. Decompression may be unsafe if you have severe osteoporosis, a fracture, ankles and spondylitis, cancer, pregnancy. One that's not mentioned on here is an aortic aneurysm. Do you guys know what that is? You guys have all rode bicycles before? You ever get a bubble on your tube in your tire? Bubbles? And you know it's weak, the tube's now weak on the tire, it's going to break. That's an aortic aneurysm. Your aorta is the main blood that runs down the center of your body from your heart. Carries all the major blood to all parts of your body. It's this big, massive artery. It's about 4 centimeters wide, all right? Anyway, it carries a lot of blood everywhere. But if that blood vessel weakens, it starts to bulge on one side. It's called an aortic aneurysm. You might have heard of people who have died from an aneurysm, have you not?
It's a weakness.
What's that?
It's a weakness.
It's a weakness, it's a weakness, and the artery just breaks. It's a good way to die. I mean, you bleed fast and you're gone. But none of us want to die, right? So anyway, that's what we look for. Anybody with aortic aneurysms, they're not candidate for the decompression. Okay? Decompression may be unsafe if you have an infection as well. Surgical hardware, pins or rods or screws, or any recent spinal surgery. You're also not a candidate for it then too. Because if there's hardware in there, you can't pull that apart.
You're talking hardware only in the spine, or what if you have it in your
Oh, you're fine there.
shoulder, ankle?
You're fine, shoulder, ankles, no problem, just in your spine.
Just your spine.
No hardware, good question, no hardware in the spine. After an initial exam and consultation, your doctor will determine whether you are a candidate for spinal decompression therapy, like we mentioned before. So let's take a closer look at the spine. We make sure that everything's okay. You have no osteoporosis, no infections going on, and no fractures, and no aortic aneurysm. So if you qualify, let's look at the procedure. For most conditions on most tables, the patient is placed in a supine position, face up. We have some handouts here to show you what it looks like, okay? There are some tables and conditions which require a patient to lie prone or face down, but we don't use that protocol. I found face down does not work as well. When treating the low back, the patient lies on the decompression table comfortably on his or her back. And a set of padded straps are secured snugly around the waist, and another set is secured around the chest. So you're hooked in from here and there. So that basically you're anchored between two different, because we have to pull apart the body, okay? Between the patient lies in the back with a pair of soft rubber pads behind the neck, so your head's very well supported. You're very comfortable. People often fall asleep on the machine when we're doing it. The The provider enters treatment parameters to set the intensity, the timing, and other aspects of your treatment. So depending on your body weight, we have to go half your body weight plus or minus 10 pounds to pull at a certain disc level. So if you're 100 pounds, we pull at 50 pounds plus or minus 10 pounds. At your L5, that's one disc level, which is 10 degrees. There's different angles of degrees we have to angle to get the proper disc level. We have to examine you first to decide which level needs to be addressed. The traction unit computer cycles through phases of controlled gentle traction or pulling, followed by relaxation. Like I said, it pulls for 60 seconds, it relaxes for 30. It pulls for 60, relaxes for 30. That creates that negative. So whenever I squish my hands here, I squish my hands down, you can hear the squish, right? Pulls for 60 and relaxes for 30. Pulls for 60 and relaxes for 30. That oscillation increases the negative pressure within your spine, which retracts the bulging disc. It sucks it back in. We've done pre and post MRIs on patients who've had it, and it's amazing. I'll tell you a funny story in a minute about that. You also receive other treatment along with decompression, such as we do ice after because you might be a little bit inflamed after you get off the table. Some people like to have heat. Those with arthritis, they prefer the heat. And we do some muscle stimulation with some interferential, just to calm things down and promote soft tissue healing. The time frame that it takes, duration of each treatment varies, but depending on where you're at, expected routines for about 35 to 45 minutes. So spinal decompression actually creates a negative pressure within the intervertebral disc space, right? We talked about that. And that's like compression, retraction. That negative pressure begins to retract the disc. How does it work? This allows the previously compressed disc to receive fluids like blood, oxygen, and other nutrients that the disc can absorb and rehydrate itself, okay? This increased nutrient supply is thought to stimulate healing within the intervertebral disc. Now stop there for a sec, Sandy. It's funny, one of my patients, he came to see me in May when we first got the machine. This was 10 years ago. And he was scheduled, he said, well, I can't do anything. I've got these herniated discs. And everybody heard of Dr. Hawk?
Yeah.
Okay, he's a neurosurgeon. Okay, he's the one who goes in and he does the operations on these discs. He's got 2 fingers on his hand, but he can still operate. An amazing man. Anyway, he was scheduled to see Dr. Hawk for surgery, and the man was a farmer. He said, I want to work on my farm. So when we brought the machine in, we put him on the decompression table. I said, I hope you're the first guy we're going to put on him. And he had 2 herniated discs in his low back. He's scheduled for surgery. May and June, but July he was finished. We did a post-MRI to see how he was. The MRI showed he was 100%. And I said, how are you feeling? He says, Doc, I'm 100%. My back's never been better. So we went to go see Dr. Hawk, and this is kind of a cute story. Dr. Hawk was East Indian. He says, okay, he said, we put the MRI. He says, oh yes, you have herniated disc here. We have to do a surgery. And then we showed him the other MRI of his disc. He said, yeah, but here's my new MRI that Dr. Pustina had ordered, and here's what we have here. And Dr. Hawk looks at one, he looks there, and he says, where'd it go? And he says, well, I saw Dr. Pustina, we did the spinal decompression. He says, well, how do you feel? And he says, I'm 100%. He says, I feel great. He says, then he got mad. He said, well, get out of my office. These were the x-rays. And he says, it takes 6 months to a year to see me. And you waste my time. But the cute part of this was he refers patients to me now. He phoned me, he says, I got irritated, but he says, I'm sorry, I didn't mean to get irritated with the patient, but the patients, and he said, I'm going to send you patients for it. And so we get patients from the neurosurgeons to do these procedures, if you qualify. Some experts believe the environment allows specialized cells called fibroblasts to begin to repair tears or degeneration in the intervertebral discs. You guys well know that you heal. You ever cut your hand? Put up your hand. We all have, right? Sometimes if this gash is too big, you need stitches. But for the most part, if you put the Band-Aid on, you keep the tissue together, what happens? It heals. Your body regenerates new cells. It regenerates over 1 billion cells every day, you guys. To regenerate, cells die, and our body keeps regenerating cells. Your body is designed to heal. You just got to give it the chance to do that. Pressure on the nerve roots and other structures is decreased, resulting in reduction of pain and symptoms. If you're always in chronic pain and there's pressure on the nerve roots, you can't heal. You're in too much pain. Your body's in a compensatory state, always trying to heal damaged tissue. Without your nerves, what's the most important organ in your body? Spine, your nervous system. People say your heart, yeah, that's pretty important too. But without your heart, without your spine, your heart's not working. You're not clinically dead until you're what dead? Brain dead. Your nervous system. They can keep your heart going, they can keep your lungs breathing. You probably know people who've been hooked up to tubes before they pull the plug. Anybody know that? We've all heard of that, have we not? All right, it might not be personalized with yourself, but you know of somebody who's been hooked up to a machine, and then the family says, "Fine, just turn off the machine because they're brain dead. They'll never function again." Your nervous system is the most important organ in your body, guys, and it's critical that we keep it functioning so that you can live a quality, pain-free lifestyle. Research suggests negative pressure created by the decompression therapy may actually draw prolapsed disc material back into the disc space. Not that it actually does, it does do that. I've seen it hundreds of times, you guys, pre and post MRIs. It's amazing. So let's take a closer look at the anatomy, okay? Here we have, we're looking at, there's a vertebrae body, a vertebral body. In between is called your disc, which goes between the two. And when it's compressed, the disc is bulging out. Let's assume this is the disc right here. There's your nerve roots. These yellow guys are your nerves. When this compresses, it puts pressure on your nerves, so it shoots pain down your legs, in your arms or hands. It's very painful, and you guys know this because some of you probably have been through that. If you go to the next slide, the vertebrae, the bones of the spine, as we put compressive forces on it, the nerves. I'm getting ahead of my slides here. But decompression therapy will begin to separate that, so it pulls. As it pulls, guess what happens?
The bulge to go back in?
Absolutely, yeah, exactly, yeah. It begins, the bulge that's bulging out there, pull these two apart. It just retracts itself, goes back in, and the pressure is off the nerve roots. So here's an x-ray we're looking at, okay? I'll orientate you guys. Here's your spinal cord. This white part here is called your spinal cord, okay? There's the front of your body. There's the back of your body, all right? These are called, this is part of your spine. See the little things right here? Those are the bumps in your spine on the very back. They're called your spinous processes. If you run your finger on the back, those little bumps you have down there in the middle of your spine, that's called your spinous processes. These guys right here. Your vertebrae protect your spine. Do you guys agree? It's a very delicate area and it's protecting it. There's your spinal cord, vertebrae, disc space. Looks good, right? Vertebrae, disc space, normal disc. Vertebrae, disc space, looking good so far. Now as we go down here, vertebrae, what's happening to this guy right here? He's bulging. If you push too much, it's like stepping on a water balloon, right? If you step on the water balloon, provided it doesn't break, what happens to the sides of the water balloon? They bulge out. That's what's happening here. The vertebrae compress each other and they just become bulging and hurting. It's your spinal cord. That's where all the pain comes from. Some of you might have seen your doctor, you've been to see your doctor before, and your doctor said, he might have shown you and taught very quickly, but you didn't quite understand because it kind of looks like Chinese, doesn't it? Right? 3 phases of treatment. First, we want to get rid of your pain and your symptoms, get symptomatic relief. We want healing, and we want to strengthen and do some prevention. Some people believe in, if you stop for 1 second, we want pain relief. Some people say, I just can do my stretching and strengthening right now, but you can't because it's too painful. And every time you do it, it aggravates your back. You think, oh, you're chasing your tail. Ever see a dog chase its tail? It catches it, but guess what? The tail gets away, right? Because they mean you can't catch your own tail. So you have to stop this procession. So stage 1 focuses on reducing or eliminating pain and symptoms. And I'm all for anti-inflammatories. That gets rid of the inflammation. That can help promote soft tissue healing as well. But you've got to get that disc back in before it starts to heal. It's important to note, care does not end with the reduction of pain. How many people have been on painkillers? You know, and once the painkiller wear off, what happens? Pain comes back. You also need care to help prevent the reoccurrence of the condition in the future. Does that make sense? So care does not end with the reduction of pain. That's critical to understand that. So recovery, well, there's a cycle, okay? As you're getting better, you're recovering well, there's often a relapse, and people have a re-injury. And I see this a lot. It goes around in circles. So you go to the next slide. Which path do you want to take? You don't want to be clear, you want to go straight to the top. You want to get better and stay better, right? I mean, obviously. While experiencing symptom relief, your body is also beginning to heal and regenerate. Okay, you're building new tissue cells. What happens when the walls of yours that hold up the disc that are holding, they break down, the disc herniates, it bulges. Right? When it bulges, the walls go, they collapse. You've got to get those muscles strong again to hold that disc into place so it doesn't continue to break down. The intervertebral discs and other damaged tissues begin to experience increased oxygen, increased hydration, and increased nutrition. Healing, okay, right here, here's your bulging herniated disc right there. You need oxygen and water to help to heal that. And healing begins, what happens is that as we reduce the inflammation, we pull these apart, it becomes hydrated. So you drink lots of water, you can do some gentle walking, but as we rehydrate this disc, it begins to heal. Muscles that were previously in a state of constant contraction and spasm to guard the stabilized and injured area begin to relax. Your body goes into a protective state. So your doctors might prescribe muscle relaxers for you, right? Everybody have muscle relaxers? Okay? It relaxes the muscle, but if the disc is still protruding, the muscle say, I can't relax because I'm still trying to protect the damaged disc. Make sense? So your body's in this fight with itself. It's kind of a vicious circle. There's your spine right there. There's your ribs. There's your head. These changes allow repair mechanisms of your body to begin to operate efficiently because you've got to get the healing process to go. It's critical that you follow your doctor's advice. A lot of people don't follow the advice sometimes. They want to do it their way. I've had that happen many times. Strengthen and prevention. Once injured areas have healed, the focus on care comes to prevention. Anybody ever hear of MEDX? Stop for 1 second. MEDX? It's a spinal strengthening protocol we have in the office. It gets your back really strong, but you can't start that till you finish this. Interesting story about MEDX. When I was looking to buy this one machine that we have in the office. It is one of the top spinal strengthening core machines that we have. And I had to go down to Florida to buy this one machine. So we walked into the gym there, and the gym was empty. I said, well, if this place is so famous, why isn't everybody here? And the fellow said, well, the place is closed down. And myself and another doctor who was a surgeon, flew down there to see this protocol. And they said to us, there's one man here in the machine, and the gym's closed down because he's rented it for himself. I said, oh, okay. And he said, don't bother him, don't talk to him, just go look at the machine, and then you can leave. So of course we go there and look at the fellow on the machine. It's a black man with a baseball cap. Here's your quiz. He likes to play golf.
Tiger Woods.
Yeah, Tiger Woods. I think I got goosebumps in his tongue. I said, wow, it's at least Tiger Woods. I said, don't talk to him. The heck with that. Mr. Woods, I'm Dr. Pustina. This is Dr. Carisco. We're looking at buying one of these machines. And the Tiger says, hey guys, you know what? Thank God for this machine. It saved my back. And this was when he was the $100 million man way back when this was popular. Many, many years ago. 2008. It was 2008 when Tiger Woods was at the top of the ladder. He said, guys, if it wasn't for this machine, I wouldn't be golfing. It saved my career. Well, that sold us right there. And that's a merit right there. So anyway, that was my story there. All right. So strengthening and prevention, we put you on the MEDX strengthening protocol, which is a different machine from the decompression. We're going to get your back. We're going to get your core muscles really strong, and it works beautifully, you guys. In this phase, your doctor designs a treatment plan that helps. We want to prevent the injury from recurring. We're going to get your core very strong. This may include exercise rehabilitation and strengthening muscles, stabilize the area, and making re-injury less likely. There's a really good strengthening and stretching protocol we learned from Mount Sinai. Have you heard of Mount Sinai? Okay, in Toronto, and we learned it from one of the best doctors on the planet. So we got to hope we can add that to this whole protocol to get your core even stronger and more flexible. Okay. Strengthening and prevention. Okay. We don't do much. We don't do boxing. Okay, but there's some strengthening I'll show you how to do. Ergonomics. We look at ergonomics. How many people here have a sitting job? Put up their hand. Okay. Sitting's hard on the body, isn't it? You guys are probably getting a little bit sore with me talking so long. But it's important. When you're sitting, you know how much you're loading your disc by? Give me a percentage. How much are we loading our disc by? 75%? Any other numbers? 250. Right now, if you're sitting there working in front of a computer, you're loading it by 250%. I'm standing right now. How much am I loading my disc by? Only 100%, believe it or not. Sitting is the worst thing on the place. It's the hardest thing in your spine, you guys. So also suggest lifestyle changes we can make, all right? Oh, just for a second. Okay, go back to for a second, the computer games. How many people people are texting and playing computer? We've got an information society, do we not? Today's children, I mean, it drives me crazy to see kids that are they're texting, or sitting there playing, or texting, or playing computer games. We've gone from being a mobile society to being very sedentary. Would you guys agree? Yeah. I mean, it's fun to play on our computers, isn't it? I mean, there's a whole world of information out there. You can search anything you want to, but also your body becomes stagnant. Motion is what? Motion, right? It feeds your body. Your body wants to move. Chronic low back pain costs the U.S. economy $50 billion per year. This is 3 years old. This presentation is closer to, probably close to 100 billion. Cost, population's gone up. Back pain is the second most common symptom for which people visit a medical doctor. We're going backwards again. Okay, just stop there. Okay, so stop there.
If you go to the blue, you can grab that little dot, and you can pull it over. You should be able to pull it over. You have to hold down the. There you go.
That was so exciting. You want me to explain that again, right? All right. So you guys, we do have some handouts here. I'll just talk about this. This is what came across. Okay, you okay? Okay. Okay, breaking the cycle. You're okay? All right. So decompression, we want to break the cycle, okay? You get injured, you're in pain, right? When you're in pain, you want relief. But the cycle keeps going around and around and around, right? We want to break that, right? And I'll show you how we do that. Health and wellness is the most important thing you'll ever have in your life. You guys, you can have all the money in the world. And I'll never forget this one patient of mine. This is kind of an interesting story. He was very, very wealthy. And he came in to see me. He'd come in every once in a while, and I wouldn't see him for a long time. He'd come back in. And he said to me, he was sitting with his head hanging down in his chair, sitting like this. I said, "What's up?" And he said, "It's not good, Doc." He told me. I said, "Told you what?" He said, "Barry told me 5 years ago to quit smoking." I said, "Yes." He said, "Well, I'm quitting smoking." He says, "Okay." He says, "I'm 57 years old. I have 57 million in the bank. I have 6 months to live." My jaw dropped. I said, "You're kidding." He says, "No." He said, "Doc, I got this cancer. It's gone through me." He said, and they said it was from smoking cigarettes. I said, "Wow." And I saw him at his funeral, but that was the last I saw him. Kind of sad. But I want you guys to look at yourself now before it's too late. Not that that's going to happen to you, but anybody smoke here? I hope not. Okay. Just a thought. It'll never get me. Okay, that was the thing that he thought. It'll never get me. And it's hard to quit. They say it's harder to quit that than heroin, they say. You know that? But they say it takes 5 times to quit. Okay? By the 5th time, you're guaranteed to quit. Only you. Doctors can yell at you, you can scream, you can jump up and down, you can rant and rave at you, you can get mad with you, but you know what? It's up to you. And all we want is you to get better. So when you're ready to do it, it's got to be worth it. It's a hard one, I know that. All right? Okay. Bottom line, does it work? Absolutely. We have some handouts here, I'll show you the statistics from it, okay, you guys? Although guarantees can never be made, research shows spinal decompression works. Bottom line. One of the most well-known studies involved in decompression of and treatment of 219 patients with herniated disc, degenerative disc disease. After completion, the study found 92% of patients improved overall. 86% of patients showed immediate improvement and resolution of their symptoms. Another study involving 144 patients showed 76% of the participants achieved remission of the pain and decompression therapy. Pretty good stats, eh guys? 2001 Neurological Research Journal study. The study found 77% pain reduction with decompression by taking pressure off the nerve roots at multiple levels. Decompression is far less expensive and invasive than surgery or drugs. Does it make sense for you or your loved ones to start with the least invasive forms of treatment and consider drugs and surgery maybe as a last resort? But often we want the quick fix in life, don't we? Spinal decompression therapy has been shown to be effective. Okay, don't underestimate the power of spinal decompression, conservative care, and most importantly, you guys, the power of your own body to heal itself when provided the right environment. You can heal, you guys. I've seen it happen. People who beat cancer. I've said, but my specialty is as a doctor with neurological conditions with spinal problems. I've seen, ask Sandy, we've literally hundreds of people come through. Results have been phenomenal. If spinal decompression and conservative care aren't enough, well, drugs and surgery will always be there, right? I recommend using it as a last resort. Why not see for yourself? You got nothing to lose. What do we want in life? Freedom. To be in charge of our own selves, to have our own health back. Okay? If you want more information, I can sit and talk with you guys, no problem. Stuck? Is that okay? That's it? And if you guys want, and we have a handout here. I don't know how many people are going to show up today. So we have some information here. This was the MD News. We don't have. We have some handouts here. So you guys, who here? If anybody wants a copy, it's all up here. Okay, just come up and get one. All right. And here's the results of it right for spinal decompression. Some amazing statistics on the back of this right here. Wheelchair and stats for decompression for bodies and what people have gotten better. Phenomenal. You guys are welcome. This is up here. Okay, you guys. Questions? Who has questions? Yes.
I guess sort of taking a while. I guess overweight.
Oh, absolutely. You know, yeah, if you're overweight, yeah, it lose your just more. It's not a wild guess.
Well,
Sure.
not help that condition.
Will it help? Losing weight will help it. Yes. If you're overweight, you'll put more pressure on your disc. Yeah. Very good question. One of the hardest things to do is to lose weight. Right? Food, alcohol, sex, and drugs. They're hard addictions for people to reduce it. Yes.
So, do you have to be referred?
Good question. Yeah, do you need your medical doctor to refer you? No, absolutely not, you guys. All right. If you guys want to get examined, you can just make an appointment. You can give the office a call. You can give Sandy, or you can tell Sandy, give her your name and number. We'll give you an appointment.
Secondary to that, if you are referred, is it covered by OHIP?
Good question. Yeah, no, OHIP ran out the door with Dalton McGinty. Yeah, and so if you have extended healthcare coverage, it's covered by that. All right, maybe. For just an initial consult with a chiropractor is covered. Spinal decompression, though, it has to be. It's not covered fully by WIP, though.
What's it cost for say a person wanted some treatments.
Good question. It depends how much damage there is and how much herniation there is, okay? It's gonna say, oh, how many antibiotics will I need to take to get rid of this infection? It depends on how bad the infection is.
So do you x-ray?
Oh yeah, if you come in for an appointment, we'll x-ray you, we'll examine you with orthopedic neurological tests. We might even you might have an MRI that I can look at, or we'll order new x-rays. We'll be very thorough to see how much damage is there first. So it's hard to put an estimate on how much does it cost, because we don't know how much it costs other than how much damage is there.
What's the initial, like you went in for consultation and?
$75.
Yeah.
Yeah. Is your health worth $75?
Yes.
Absolutely, you guys.
Well, I know I went to chiropractor once. It was the best thing I ever did. Something went out, I was trying to walk up the stairs with help carry this wheelchair, and all of a sudden I just felt a stabbing pain in the middle. Actually, it was Brian Schroeder
Yeah.
that did it. And I spent 2 years, it felt like a knife stabbing through my back, you know, like it, and I just thought, well, it'll go away, it'll go away, it'll go away. So he showed up at one of our meetings, years ago, and he says, "You've been putting up with that for 2 years?" I says,
Wow.
"Yeah." He says, "Well, come on in." So I went in the next day, and he x-rayed me, and he did all kinds of tests, and he worked on me a little bit, and I left there, and I felt a little bit different. It was feel stuff moving around, and then the next time I went back, he didn't seem to do very much, and I went back the following time, and the next time, and he put me on that drop table, and I said, "It needs something right." I pointed at the spot,
Yeah.
and he hammered that thing. I thought he broke me in half, but you know, I was so scared when I left there, I never went back, but the pain was gone in 2 days. It was gone.
Yeah.
It never ever came back, you know. It's years ago. Yeah.
That's a very good point, you know, and do I do that, you know? Chiropractors are stigmatized for beating you guys up, right? And cracking bones and things like that, right? I don't do that. We've got a whole different protocol. That's why I got into spinal decompression. It's a more gentle way of approaching things. And I don't do that. That's really harsh chiropractic. And it works for some, right? But I seem to do some damage too. Some people have been to a chiropractor, they say, "I'll never go back." And because, I mean, it's too rough, they can't handle that. And you have to be very, very careful, especially when you're dealing with people's bones. And herniated disc, oh, absolutely not. You wouldn't get that at all.
Well, this was up in the upper back. It was,
Yeah, upper back, mid back.
Yeah.
You probably had a rib out of place.
It must have been because when he hit me, I guess he knew what he was doing, but when it hit me, I thought, holy cow, I thought he broke my back. You know, like, and I left there, paid the bill, and my hands were all tingling when I left that.
Yeah,
And it went away. It was 2 days, and it was gone. That pain never showed up again. Yeah.
Yeah. So yeah, chiropractic does work. It all depends on what you need. Everybody's different. Yes.
So in my mom's case, she has spinal stenosis.
Yes.
L4 and L5, don't know when they were damaged. I suppose it was probably polymyelitis. She cared for my father for years.
Right.
So it's been several years that she's been like this, but because she has arthritis, she didn't know that there was something different with her back other than an arthritic pain.
Right.
So she also has osteoporosis. She's on Prolia.
Right.
So how likely would she be for something that the discs have been bulging for an extended amount of time that we didn't know, and that she does have osteoporosis? What kind of situation does that put her in?
Good question. It depends on what level of osteoporosis she has. Is it a level 4? Is it 1, 2, 3, or 4? The bone's gray, right? And then it also depends on how much bulging the disc is and how much degeneration there. And also, if she has spinal canal stenosis, the spinal cord is getting choked. There's gentle exercises that we can teach you how to. She might just be a candidate only for these gentle stretches I learned from Mount Sinai. So there's over 21 different exercises that you can teach people how to open up the spinal cord, right? When she sits, does her back bother when she sits, or is it comfortable when she sits?
Does it hurt when you sit? Does it come out?
Okay. And how about if you lean forward there. Go ahead, grab your ankles, lean forward. How's that feel? Lean forward.
He's asking you to lean forward then.
Does that feel better?
It's tight.
Tight, okay. Yeah, so the disc will bulge you lean forward. Spinal canal stenosis, there's a whole bunch of different exercises you can do. Right? And I put a 90-year-old on the decompression machine. It was great. He was an old fellow from the Ukraine, and he worked on the railroad, and he worked, you know, because he met Hitler and all these other guys. And he said, "I used to crush people's hands with my hand. I was very strong." He was the old Ukrainian. And he shook my hand, and he shook my hand. He could barely squeeze my fingers. He says, "I shake like women." I'm telling you what he told me. It's kind of entertaining, and it says, "Well, you know, let's try the decompression and see if we can help you." We did the decompression protocol, and when I finished, it was 8 weeks later. He said, "I want to shake your hand." And I said, "Okay." And he grabbed my hand, and he almost crushed my hand. I said, Whoa.
You be telephone, okay?
And he says he's in Ukrainian, yeah, I crushed your hand. Now you shake like a woman. And I said, yeah, you're very strong. So he gave him his life back. It was amazing. His strength came back.
So my mom then would get the most recent MRI, all
Yes.
the stuff, would that be sent to your office, or should she bring that in on?
Bring it in, and then I can load that. Yes, please.
Okay.
Bring it in, that'd be great. I want to see everything.
Okay.
Okay, how old's your mom?
84.
84, okay, good.
83. Well, 80, should be 84 this year.
Yeah, the oldest one we put in the decompression was 90, and he did great. Okay, he did very well.
Okay.
Okay, so see, she qualifies. Okay, anybody else? Yes.
What if somebody's been in a car accident?
Good question. Yeah, very good question. Yeah, if you've been in a car accident, the question is, do you have a sprain, do you have herniated disc, bulging disc, do you have, there's different levels of accident. There's WAD 1, WAD 2, WAD 3, or WAD 4. Are you guys familiar with those terms? WAD 1 is considered by the insurance companies a minor whiplash injury. It takes about 6 to 8 weeks to get better. A WAD 2 is a moderate injury, okay? A WAD 3 means you have neurological damage, like a disc damage. And so now you have, and WAD 4 means you're paralyzed. So if it's a WAD 2 or 3, yeah, we definitely handle those. We don't go beyond WAD 4. It depends on how much damage was done from the car accident.
What is that acronym that you're using?
What's that?
What's that acronym that you're using?
Oh, WAD, W-A-D.
Oh, okay.
Yeah, it's called WAD 1, WAD 2, WAD 3, or WAD 4, okay? It's the way we diagnose what level of damage there is. WAD 4 means you're pretty much paralyzed. You've got severe spinal cord damage. Yeah. So we look at what level you're at to see. And if you're WAD 4, how much we can do for you. WAD 2s and WAD 1s, 2s, and 3s, oh yeah, they've done very well. Yeah.
He was wondering if you accompany your treatment with nutrient
For nutrients?
for recovery, like,
You know, I recommend vitamin C.
anti-inflammatories,
Well, yeah, if you,
say calcium, magnesium, that
good
kind of
point.
stuff.
Okay, excellent question. Yeah, calcium and magnesium are at the top of the ladder. You got to increase your calcium and magnesium supplementation for sure, right? Vitamin C is up there too because it promotes soft tissue healing, right? So I recommend you do that. Some people want to get on anti-inflammatories too, like naproxen. You've heard of naproxen or naproxen. Medically, it's naproxen. Okay, but it's hard on your tummy. It eats away your stomach, guys. And it'll cause ulcers and all kinds of other problems. But I mean, it helps get the ball rolling, but naproxen is kind of, it's tricky. So depending, some patients are on supplemental medication as well, but they can do it. The majority aren't. The majority of people that come to see me are saying, I'm tired of my medications, they aren't helping me anymore, doc. Now I've got other problems. I've got bowel problems, I've got constipation, or diarrhea, I can't take these meds anymore, and they're upsetting me. And their doctors have said, well, stop taking the meds, but then the pain comes back. So it's kind of this juggling act, you guys. So it all depends on what the condition you've got.
Do you have any other physical supplements, like a special chair cushions or bed or?
Well, yeah, see what a special bed, yeah, I mean, there's, then we get into a whole different can of worms there. What bed works, what bed doesn't, right?
Yeah.
If you have a spring mattress, you need to have more than 1,100 coils, okay? More than 1,100 coils, right? Anything with 1,000 or under, not enough support. There's the sponge mattress, you know, the people do the sponge mattresses.
Memory foam?
Yeah, memory foam, okay? Half the people love it, half the people hate it. So, I mean, it's either, it's like pillows. People have certain pillows, right? You ever go to a hotel? Aren't they the worst pillows on the planet, the majority of them? Right? Because your neck's slipping like this, you got this big buffy pillow, your neck, you can't get out, your neck's sore for the next 4 or 5 days. So we're all different as individuals. I can't say what works for some. You know, the CD Posturepedic mattress is well known and people love it. But they have to have more than 1,100 coils. That's definitive, okay, guys? Anything under 1,000 coils, don't touch it.
Well, the therapeutic cushions that you put on your chairs.
Yeah, I mean, those lumbar supports, exactly, those are good. People, I prescribe those all the time. It's got a bit of an arch to it, and it's got support. Your lower spine, I didn't bring the spine with me, but you got 4 curves to your spine, okay? Cervical, thoracic, lumbar, and your sacrum. It goes like this, okay? It's like an S curve. But you need lumbar spine support. So people, when you're sitting for long periods of time, some of you might be getting a sore back. So if you put a cushion back there, it supports you. Oh, that feels kind of good. Do you guys agree? Same for if you put a cushion back, it supports your lumbar spine because it supports that arch back there. Because you got this arch here, so you put a pillow back there, it supports when you're sitting down, so it keeps the curve there, right? And when people are now they have little small pillows you put behind your neck when you're driving your car. So you're supporting the curves as you're driving. So yeah, the curves do need support. So I will prescribe, lumbar spine support braces or whatever people need depending on how much damage there is. Good question.
Do you do other chiropractic besides this,
Yeah.
this table?
Yeah, well, yeah, good question. What else do I do? We do all kinds of stuff. I specialize with peripheral neuropathy. You guys know what that is? People with diabetes who have been through chemotherapy, they lose sensation, okay, into their hands, they lose the nerves, they die, and they lose circulation. You might have seen diabetics in the hospital, and they're sitting in a wheelchair, and their legs are gone, right? They lose the circulation in their legs, and eventually their feet have to be amputated. So we do a whole protocol to get circulation back in the hands and the feet. With peripheral neuropathy, people have a lot of limb pain, hand pain, pins and needles, and leg pain. So we specialize in that. I specialize in spinal strengthening and conditioning. We have basically, we have, Sandy, what else do we do? We do laser. People have inflammation. People with temporal mandibular joint. We specialize in this way for temporal mandibular joint. You guys know what that is? TMJ, the jaw. People have clicking their jaw. They always got chronic jaw pain from chewing their jaw clicks and punches. So we specialize in many things. Yeah.
Do you do any hair analysis or anything for
No,
to check your?
I don't do the hair analysis. No. Yeah, Dr. Schroeder does that. Yeah.
I thought, does Brian do that? I thought Cranton did that.
Cranton might do that. Yeah.
Yeah.
I found there's been some, I guess, controversy over that is totally accurate. So, so I didn't go towards hair analysis. I'd rather just analyze your whole body, do a complete history on you, go from there.
Because, I mean, like contamination, or if you had different levels of copper or different stuff in your body, wouldn't that affect your, shouldn't the person really?
Totally. Well, we have we test all your electrolytes. We have to see how much acid you have in your body. We test with the chemical acid test to check your pH levels.
Oh, pH.
Okay, and if your pH levels are high, we do a complete saliva test on you, right? And if your pH levels are high, it means you have high acid content within your body. If the acid's high, you're gonna have all kinds of problems. And we have a whole program to help balance that out. That's a good question. Yes.
From a personal standpoint, I have osteoarthritis in my neck.
Yes.
And it's caused me a lot of pain over the years, and it's not something that's getting better. It's the osteoarthritis is actually degrading the vertebrae itself.
Good question. You might not be candidaate for spinal decompression. It might not be a disc problem, but it sounds like it's a bone problem. So that's the program I have for Mount Sinai. It's a whole neck stretching program for Mount Sinai. It stretches me for about 6 weeks. I'll show you all these stretches. I teach it. It comes in a book of form. I teach you how to do it. You can do it at home. When I learned that protocol, there's kind of stretches. I mean, being a doctor for 30 years, I learned a whole bunch of new stretches. And I went down to study, and this fellow's name was Dr. Carlos Amendolia, and Sandy and I went down to study and to visit him. So I went to his office. He's at Mount Sinai. We walked in his office, and there's a man in a white lab coat there. And it wasn't Dr. Carlos Amendolia, it was his patient. The man in a white lab coat said, "I'm Dr. Solms, I'm head of Mount Sinai rheumatology." I said, "Okay." Then he said, "I'm this jerk's patient," which is, there's a bit of a medical, there's a bit of a war between chiropractors and medical professions on the outside about the turf war. He said, if it wasn't for this jerk, his next place, he said, I wouldn't be walking. I couldn't walk down the halls before my legs would give out on me. He said, I went to see my physiotherapy people, they didn't know. I saw my orthopedic surgeon friends, they didn't know. This man saved my career. It's been so successful that Dr. Carlos for that. It's going to be in every hospital by 2022. And we've got that protocol in our office as well. And it's for the neck and for the whole back. And so we have many other things that we can do. Guys, you might not be candidate for decompression, but you might need a good home stretch and strengthening program I can show you that's so advanced and so new that it's beautiful. And I was blown away by those stretches. I saw the neck. I said, wow, I haven't seen these before. I've been a doctor now for 30 years.
And with regards to the MRIs, is that something that you're requesting from Dr. Pustina?
You know what you can do? You can just get a copy and bring them to me. And if you get a copy, or you can bring the disc into me too, whatever you want to get those two. arthritis is no fun, it's painful, and it affects your quality of life. You might not be able to get rid of it, you can be function at a better level, at a more qualitative level.
The upside is I've quit all medication and CBD seems to help.
Awesome, good, yeah.
So it's THC as well.
Yeah, okay, no, I get that, and I totally get that, but you're a young man, so it's not good to suffer like that, it's not good. And so if you want to check with Sandy, give us a call, okay, see what we can do. Any other questions, you guys?
Whereabouts are you located?
We're located, okay, do you know where CAA Auto is on Memorial? We're right across the street. It's in a little, it's like, there's Cooperative Church was there, they've moved, okay? There's a little L-shaped building, we're in the part of the L-shaped building now. So we're in the long part of that building, right across from CAA Auto. We're called Spinal Health and Rehabilitation Center, we've got a big white sign up in the front there. Did we bring the cards? Okay, the cards, okay, just hand over, I think we're on the back of here, right?
No, those are all that.
These are all the addresses? Okay, this is all the addresses.
The trip takes a good
Just
process.
move.
767-7000, everybody say that.
7,000.
Right, you remember that, that's my number, okay? All right. What's that right?
Lambert Insurance.
Yeah, Lambert Church is right there, that's exactly right there, and used to be, yeah, that's where we are, yeah. And we got an exercise facilities, you guys will like it, we got some really cool stuff there. I got a little gymnasium there. How many people here have been to a chiropractor? Okay, how many chiropractors had gymnasiums in their office? Yeah. None. That's what I got in my office, I got a complete, the medics protocol for strengthening the neck and the whole back, I got a whole system there that's gonna get you guys in better shape. Because I believe that chiropractors can do so much, but if you come in and just get adjusted out the door, you go, there's more you can be doing. I'm gonna show you guys what you guys can do. So you can have a better quality life. Yes?
You said, or it showed up there, you said that you can't help do spinal decompression on someone with ankylosing spondylitis. Can you do anything for them at all?
Yes, stretches. There's some really good stretches we can do for that. Because the problem with that, you know what ankylosing spondylitis is, you guys? It's like your spine starts fusing from here on up. Starts fusing and fusing, and you sort of bring you forward. Next thing you know, you might have been by the hospital, you see this guy walking around like this, you guys know the man we're talking about? He's walking like this around. The poor fellow, he's got severe ankylosing spondylitis, his spine's been fused. It starts trying to fuse itself. It's a progressive autonomic problem that doctors haven't figured out, but you want to keep it as mobile as you can to stop it from fusing.
Well, that's what one lady, she had it, and they said your neck could break at any time or something, so they have to operate, and they put this thing in, so she couldn't look up, and she couldn't move her head, so she could look down like that.
Yeah, the poor thing. I know it's horrible, you guys. I mean, I feel bad for these people because when their spines are fused, they have to start walking like this. A lot of seniors have to walk like this too. You know that? Yes, they got. What do they have in front of them? Walkers. They start walking like this, right? Why are they doing that?
I think the walker's too low, I think it should be up.
It should be higher. You know, guess what they have? They have ankylosing what? Spondylitis. And what happens? And as the spine begins to fuse, all right. And they also have spinal canal stenosis. Okay. They don't have all have ankylosing spondylitis, but most of them have spinal canal stenosis, which is very common. And your spinal canal stenosis, they bend over, it opens up where they can walk better like this. It's different than ankylosing spondylitis because they bend forward like this, and when they're sitting in a chair, they have to sit forward and lean forward. It feels good to lean forward because it opens up the spinal cord. So there's a lot of senior people like to walk like this because it feels better in their spine. And you know, when I was growing up, my mom said, stand up straight, right? Walk like a man, right? And as these people try to stand up, they hurt. My dad had it. My dad, he was very functional, but he started walking like this, and the more he wanted to walk like this, then I went to the spinal canal stenosis protocol. He's walking straight, and I was able to walk. He couldn't even walk to the end of the driveway and back. His wife told me, and I said, let's do the spinal canal stenosis protocol. By the time he finished, he's walking around. You know the waterfront, the island where people launch their boats. People walk there with this. You can go a short route or a long route around there. My dad was doing twice around there by the time he finished them. And he wasn't able to go to the end of the driveway and back. Yeah, so really good stretches we can do for that.
So what would cause this ankylosing spondylitis? What is that?
Good question.
Is it arthritis? Is it an arthritis type of a thing, or is it?
Your spinal cord gets narrowed. I guess it's probably a degenerative thing. It begins to get choked. Is it caused by discs? can get complicated, but just if they herniate or bulge, they start to choke the spinal cord. Or is it degeneration, which the spinal cord starts to close on itself? Regardless if it's the disc or if it's the spinal cord closing on itself, you have to open this up back here. And the protocol that opens up the peel like this, but we teach you, there's a series of over 21 exercises I show you how to do. So if you can do them, you have to do them daily, but it works. And my dad was walking around 10 blocks by the time I finished with him. He was 85. And he wasn't going to the end of the railway back. He was very frustrated because he used to like to run. My dad turned 70, we ran the 10-mile work days together. That was amazing. Then he started, as he got older, he deteriorated. But he kept him mobile this whole time. Yes?
Once you've remedied the decompression part, is there preventative exercises that you...
Absolutely, good question. Yeah, I've got some really good exercises you guys can do. So I'll teach you how to do it.
Especially
For your core, yeah. Welcome to the core, eh, guys? I mean, this is something we always going to deposit weight in our core. It's hard to keep this part of our bodies slender. It's the one way to ever. Yes.
I could show you an exercise I did myself, but as long as you don't have a herniated disc,
Yeah.
I'll show it to you. Anybody can do it. If you got a minor back pain or something, I showed that thing to practice different guys that push. I used to go to Pustina and they heal their backs. It's a simple thing to do, nothing to it. If you can't have a herniated disc, after he gets through here, then you can do this. It's simple. You put your arms, elbows up as high as you can on a wall or a door, like this. You stand on your toes as high as you can, and you stretch your back like that, and you hold it like that as long as you can when you're breathing in and out. See that?
Those are called the McKenzie exercises.
Yeah.
You can do them on your stomach, and then you put your hands in front of you, on your stomach, and you push yourself into the extension.
You got to hold your stomach in too.
Yeah, they're called the McKenzie exercises, but you're doing a standing up version of the McKenzie exercise.
Yeah, well, it works. It just,
Yeah.
that's all. I
It's okay, but if you have facet arthritis, facet arthrosis, extension will it'll hurt. So that it might be good for some, but if you have facet arthrosis or your facet capsules, which is the posterior portion of your spine, anything extended, it bites. So it's hard. That's why people say, I can touch my toes, but as I go back, you can't do it because it hurts. It's their facets.
All I know is this, I helped out with 4 or 5 different guys over there.
Yeah.
Backs are okay in 2 weeks.
Yeah.
I said, you got to do it. I said, if it starts to hurt, stop.
Yeah.
And I told them, I got a herniated disc, don't do it.
Yeah.
But they had minor stretch it or something.
Stretch.
What that does, it bunches up the muscles.
I agree. Stretching is good for everybody, guys.
Yeah.
How many people here stretch regularly? Okay? Half the hands go down to half the hands, a portion of the hands go on. The stretches are great, but stretching hurts. It's not fun to do. Okay? But it's necessary that we do it and stay mobile. You know? And if you need just a stretching form, I got some good stuff for you. So, yeah, good point. Excellent. Thanks for sharing that.
What's your opinion of the rebounders? Like
Rebounder, they step on
little
some
bounce,
rebounders?
just a little bouncer.
Yeah, a little bouncer.
I found
Okay,
it.
don't fall off of it.
Oh, well, I'm just to bounce lightly
And
because some
seniors
people
don't have the
have.
best balance, okay? Especially with peripheral neuropathy. Seniors, they get over with spinal canal stenosis, and with peripheral neuropathy, they shuffle. How many people, seniors that shuffle? You know that, right? They take short steps like this, right? They can't take big steps because they have spinal canal stenosis. They don't take these big, long steps like this. They walk, just short little shuffles, because that's as far as their feet will go before they lose their balance. So yes, that's all. It's a tricky area. It's depending what they have, you know. But yeah, but I put my dad in I used to go over to his house every day and stretch him. And his wife said, "Can you come over and stretch your dad?" I said, "No problem." By the time I finished stretching, he was walking, a long walk. And I can show you guys how to do these. It comes in a little booklet. I teach you guys how to do them. You know, you might just need something like gentle stretches too. Hard to say. It's hard to diagnose just from talking. You know, so if I examine you, do a complete exam, I'll find out what's going on with you. We can find the timing works best for you. Any other questions? Okay. Well, you guys, thank you very much for your time tonight. I really appreciate you guys taking the time. And congratulations to each and every one of you for taking the time and interest for your own health. I hope I got some valuable information to you. If you do want to come and see us at the office, give your number to Sandy or give the office a call. What's the number? 767-7000, guys, okay? give the office a call and tell them you're at the seminar, okay, guys? And we have some information up here, come and grab a handout if you guys want.